we're going to go over the frequently asked questions about liposuction and lipo-sculpture. One of the most common question is what are the complications or potential complications for this procedure. But before I go over the potential complications, I want to talk to you about actually how the liposuction and lipo-sculpture happens, what type of surgery we do, and if you understand that, then understanding the potential problems are very easy. Liposuction is not just sucking the fat. What I do in my practice is called safe lipo, which is separation, aspiration, and fat equalization. What that means is initially when we take the patient to the operating room, whether under local or general anesthesia, we inject tumescent fluid, which is the diluted lidocaine with epinephrine, with saline into the skin on the area that are already marked in a pre-operative session. And then we use the power-assisted liposuction device and make small incisions in the desired area, and then start separating the fat from the tissue, and then we aspirate the fat, and at the end in order to give the patients good contour and appropriate contour, we do fat equalization. And so again, the procedure is not just sucking the fat, is actually giving the patient desirable shape and contour, and so it requires a very deep understanding of anatomy in the shape of the abdominal muscles, whether in the front, side, or back. And obviously some of these procedures are associated with abdominoplasty, with or without fat grafting, which we basically harvest the same fat that we got and then inject it whether into the breast or the buttock area to basically give more curvature to the patients and restore their shape. Now that you understand the surgery, let's talk about the possibility and potential of complications. So because we go under the skin and basically separate the fat and suck the extra fat, there's a lot of dead space or free space underneath the skin between the muscle and the skin, and that creates called seroma. So a lot of fluid accumulates in that area, and most of the time initially it's bloodish fluid, and then it's like a yellowish color fluid called seroma. So some of these patients, they would have a drain, again if it's a very extensive liposuction, or if it's minor liposuction, they just have their liposuction holes left open for post-operative drainage, and some of them again they require manual drainage with the appropriate massage after the surgery. So the risk of seroma or bleeding and infection is very low. It's maybe less than 1% possibility of infection and bleeding, but seroma is very common, and again requires very close attention to the post-operative instruction. Now the other potential of problem is the changes in the skin sensation. Obviously we traumatize the skin, be it with the liposuction device, and that creates a little swelling and numbness of the skin, but majority of times it's reversible and it goes back to normal in majority of conditions. DVT or deep venous thrombosis or blood clot in the leg is a possibility, especially if it's a long procedure. We give the patient sequential stocking, which basically gives patient pumping during the operation for the blood to circulate and minimize the risk of DVT. But after the surgery, we also recommend these patients to walk around, and that will decrease the risk of blood clots in the leg. Pulmonary emboli secondary to the blood clot or fat that we do liposuction is a possibility, which is very rare but can be very significant problem for the patients. Damage to the intra-abdominal structure is a possibility if the patients, when we do the liposuction with the device that we have, if we go extremely deep, and sometimes it can cause intra-abdominal damage, which is very, very rare, and it doesn't happen usually in a very experienced surgeon, but that's one of the complications that can happen. Irregularity and unevenness is very common, especially the first 3 to 6 months, but majority of times it settled down, especially with the safe lipo that I proceed with, and normally they improve significantly after the surgery after 6 months. But if they have unevenness that stays after 6 months, we always can fix that with a simple procedure. The other question is how painful the liposuction is. It really depends on the extent of the liposuction. Obviously, if it's a very localized area, the pain recovery is very minimal. Obviously, if it's a very 360-degree or the whole trunk liposuction, and the recovery is going to be longer, and the pain and discomfort is going to be longer. Majority of times, the patient has significant pain for the first 3 days. After that, it subsides, and majority of the patients after 2 weeks, they don't require pain medicines, and after 6 weeks, they don't have pain and discomfort. But overall, recovery takes 3 to 6 months. The last question is the liposuction permanent? No, liposuction is not permanent. So obviously, the areas that we do liposuction and we remove the fat cells, they don't come back, they don't grow back. However, there is still fat cells in those areas, and if the patient does not follow the appropriate healthy diet and does not exercise and gain weight, they can gain weight in those same areas or the areas that the liposuction did not happen. So that's why it's very critical for patients after the surgery to keep their weight at the same amount, follow the very healthy diet and exercise routinely and regularly in order to keep the results in a longer terms. If you like this video, please like the video and subscribe to my channel. I have many more educational videos as well as the actual surgical videos which might be your interest, and also if you could share that with your friends that are interested to know about these subjects. You also can call me directly to my office, 949-646-844 for free consultations, or whether in my office or telemedicine, and I'll be happy to also respond to your comments under the video.